And welcome everyone to another Mark Bishop show. Here's a question for you. If I was to ask you, what is a common condition that affects more than half of men above the age of 60? What do you think it would be? Fact, by age 60, half of men suffer from benign prostatic hyperplasia, BPH, also known as an enlarged prostate. The common condition causes patients to experience difficulty starting and stopping urination, feeling a frequent or urgent need to pee, and being unable to completely empty one's bladder. My special guest is Dr. Rahul Mehan from the East Valley Urology Center here in Arizona. Welcome, Doctor.
Well, thank you so much for having me.
Well, Dr. Mehan, for most men, oral medications are the initial course of treatment. However, many people experiencing symptoms of enlarged prostate may be looking for other options, correct?
Oh, absolutely. Typically, 1 in 5 men will discontinue medications in their first year and look at other options. And I'm really excited today to be here and to talk about enlarging prostates. And I'm working in collaboration with Boston Scientific, and we're going to talk about Rezūm Water Vapor Therapy as one of those options.
Fabulous. I think it was something like, I was reading the stat, 60% of men actually do discontinue their BPH medications within the first year. Why is that, do you think?
Well, medications work, and all the options are helpful, and they have pros and cons, risks and benefits. But, for medications, they may not work for everyone, and they require consistent use and have undesirable side effects, including sexual dysfunction and dizziness.
Well, I tell you what, you're bringing this close to home for me. I got to tell you, I take tamsulosin, and I'm going to be talking to my doctor about this. How common is this condition, and what are the most common symptoms then of an enlarged prostate? I might be doing something different to others. Is it for general? What's the general for men?
Well, typically these are guys that notice a change. They'll start waking up at night to urinate. They have a weak, interrupted urine stream, a hard time starting and stopping, feeling a sudden urge to urinate, not being sure their bladder's empty, dribbling at the end of urination, and an inability to go when they feel they need to go. And it can get, symptoms can start out mild, and usually guys in their 50s may notice that there's a change happening here. I'm learning where the bathrooms are in public. And as men get older, that prostate grows from the size of a walnut to could be the size of a lemon. And then, they're dealing with severe symptoms where all those things come into effect and it's severely impacting their quality of life.
Yeah, it's no fun at all, is it? Some more progressed than others, some worse conditions than others. But when you talk about, size of lemons and stuff inside you, it's, it conjures up visions, pretty scary visions, in fact. I mean, what can it lead to?
Well, it's, again, a very common process, and BPH stands for benign prostatic hyperplasia, which is not a cancerous condition. This is just a normal growth of the prostate, and it happens over years, over decades. And, it doesn't cause, per se, cancer or anything, on that nature. But over time, it can really affect not just the quality of life of the patient, but the health of the bladder. If the bladder can't drain and it is backed up with pressure, it can deteriorate over time. And if you let this go, it can wreak havoc on the entire body.
Yeah, well, I think another big thing is if you don't get your sleep, it's a known fact. So getting up, 3, 4, 5 times a night, there's no fun in that either. Broken sleep. Available treatment options for an enlarged prostate? There are side effects, aren't there, at some of these treatments?
Yeah, all of them. They have risks and benefits. And, in the past, when I first started doing this a decade ago, we would start men on medications. And if that didn't work, we would offer traditional surgical treatments. But what we've seen in the last 7 years is a renaissance of new technologies. And we now have minimally invasive procedures that we can perform in our office to treat men. And these options do a great job of treating an enlarged prostate while preserving sexual function.
Okay. Well, there is an exciting new one. You want to share about that with us?
Yeah, this is Rezūm Water Vapor Therapy. And it's terribly not that new. This came out in 2015. I've been doing this in Arizona for 7 years now.
Well, how come not many people have heard about it, Doctor?
Well, that's why we're here today. I'm so excited to talk about it. I really want to demystify this and bring awareness. We have options.
All right, this sounds exciting. Rezūm Water Vapor Therapy. So go, tell us all about it.
Okay. So what is Rezūm? How does Rezūm work? Well, Rezūm is a minimally invasive in-office procedure to treat an enlarged prostate, not just the symptoms. It uses water vapor, which reduces the size of the prostate and provides lasting symptom relief while preserving sexual function. It works by using the energy stored in water vapor or steam. And that water vapor goes in between cells and destroys them. And over time, the body's natural healing response absorbs that treated tissue, shrinking the prostate. And when that extra tissue is removed, the urethra opens, reducing the symptoms of an enlarged prostate.
Wow. Magic. Absolute magic. But now it conjures for me visions of, the steam shooting up the urethra and burning the hell out of me. Now tell me how it works.
Not at all. It's very contained. So this is, again, done in the office. You don't need general anesthesia. It consists of 9-second water vapor therapy. And basically, I'm able to target specific spots of the prostate. And they're small areas, like 1 centimeter. It's super small.
Wow.
And I can target just that spot and deploy steam in there, which will open that area up. And you're still like an artist as a urologist. I'm in there and I'm opening up specific parts of the prostate and making that channel so men can pee better.
Well, does it reduce the size of the prostate?
Absolutely. And it's durable. They had a study last year. They published their 5-year outcomes. And this is a multi-center randomized trial that was published in the Journal of Urology. And they showed sustained symptom relief and a low surgical retreatment rate of 4% out to 5 years while preserving sexual function. This is something that's going to last and work very well.
Yeah, well, that was going to be a question I was going to ask you. The lasting capability, promises, but something's got to stick around, hasn't it, for it to work?
Yeah, you need to look at the data and what research has been out there and really sit with your urologist, make an appointment and be examined and have all the options reviewed with you and make a shared medical decision and find a treatment option that's going to work for you. And I think Rezūm should be part of that conversation.
Well, doctor, tell me, can, man typically resume normal activities, within a few days after the treatment?
Yeah, this is minimally invasive. So patients come have the procedure done. It's a one office visit procedure and they go home and it's done. And following the procedure, patients may experience side effects such as painful or frequent urination, blood in the urine or semen, or an urgent need to urinate. Side effects are typically mild to moderate and resolve within a few weeks.
Well, when you say non-invasive, I love the idea. No needles, no numbing, no jabs anywhere. Just, it sounds too good to be true.
Well, it's different for everybody. And the way the procedure happens and what kind of anesthesia is given, it varies too. You really need to talk to your urologist and see how they perform it. And there's you can have it done so many different ways to help meet your expectation and minimize the discomfort from that procedure.
Well, it sounds fabulous. There you go, guys. Finally, magic has happened, and you want to read about this. I can hear them now, rushing to the computers. You ready? It's www.rezum.com. Don't fall into the E at the end because it's called Rezum. It's just rezum.com. That'd be the best, Doc, right? And study it all up and go from there.
Oh, absolutely. And there's a link there to find a doctor and also a quiz that you can take to put your own symptoms in there and get a number of how bad the situation truly is. And I think that has power and impact to lead you to find and seek help.
And relief. Oh, wonderful. You've made my year, Doctor. Thank you very much. Dr. Rahul Mehan. He's from the East Valley Urology Center of Arizona. Of course, Arizona. What else do you expect? Nothing but the best, huh? Thanks, Doc. Have a wonderful year.
Thank you for having me. Take care.
Goodbye now.